Welcome. I'm Dr. Alexis Gopal of Vitality Medicine of New York, and thank you so much for taking time out to watch our video. I hope you get something out of it, a little firsthand knowledge about what functional medicine is. Many of us are suffering from chronic illness and not getting better with traditional medicine. I'd like to introduce you today to functional medicine, a different way of looking at chronic illness that may be able to help you restore your quality of life. A little bit about me. I am a board certified internist with over 25 years of experience. And after realizing that most of my patients were not truly getting better, and I was just managing disease with medications, I decided to look for a different approach where healing would actually take place. And that led me to seek out functional medicine. But first, let's talk about the American healthcare system. Our healthcare system is definitely broken. Corporations are buying hospitals and medical practices, and the practice of medicine has become a business meant to generate profits for the corporation at the expense of patient well-being. Decisions traditionally made by physicians are being made now by administrators. And this is a crazy statistic. Primary care doctors have about 7 or 7.5 minutes per patient to address numerous chronic illnesses. And in internal medicine, most of the patients are quite sick and have at least more than 5 chronic medical issues. So imagine 7 minutes. How much justice can you do to your patients in 7 minutes? Physicians are forced to practice assembly line medicine, reduced to putting out fires with medications. Doctors spend a great deal of time fighting with insurance companies to get appropriate testing approved for their patients, many times being denied in order to save money for the insurance company. And patients with chronic illness are suffering with this Band-Aid approach to medical care. Chronically ill patients suffering from things like depression, fatigue, insomnia, reflux, irritable bowel, autoimmune disease of all types, asthma, diabetes, hypertension, obesity, eczema, hair loss, low libido, chronic pain, and many, many other conditions are getting really frustrated because they're not getting better despite being on numerous medications. So what happens? Some patients just suffer in silence and they think, well, this is how it's going to be for the rest of my life. And, they become very depressed and, their quality of life is terribly affected. They don't have the energy to play with their children, the energy to dedicate to their relationships. And it's quite demoralizing. Others desperately seek out care with alternative practitioners like acupuncturists, naturopaths, chiropractors, energy healers, with mixed results. Now, either through research or word of mouth, some chronically ill patients find their way to a functional medicine provider or practitioner. And that's not easy because a lot of people don't know what functional medicine is, have never even heard of it. Even many physicians don't know what it is. Sometimes, through research, patients are able to find us. Functional medicine, what is it? It's an evidence-based approach to chronic illness. So it's backed by science. It's very holistic. It's not fragmented like traditional medicine. And it's basically just a different way of practicing medicine. Instead of just treating diseases, we look for the root cause of symptoms and we address it at the cellular level. And that's what distinguishes us from traditional medicine. And there is a need there is a great need for functional medicine. Look at these statistics. 80% of Americans take at least one prescription medication daily. I think those figures are higher now, and most people take more than one. I have patients who are on 2, 3, 4, 5, 10 medications. Polypharmacy is a huge problem in this country. 9% of teens in the year 2000 were pre-diabetic, compared to the year 2008 when that number went up to 23%. That's crazy. They predict that in the year 2030, half the U.S. population is going to have chronic illness. And they also predict a doctor shortage. By the year of 2025, we're going to be short 90,000 doctors. So it's going to be even harder to access care, to medicine, as if it weren't already hard. I mean, sometimes you have a 6-month waiting period before you can get in to see your primary care doctor. So treating the root cause, what does that mean? So, most chronic illnesses have a common cause at the cellular level. And therefore, we don't treat patients according to disease. We kind of take a holistic approach and see what's going on. Root causes of illness include things like inflammation, toxins, nutritional deficiencies, hormonal imbalances, leaky gut, hidden infections like Lyme disease or Epstein-Barr virus, and others. Those are just some of the most common root causes. And how do we get to the root of illness? There's a really wonderful tool called the Living Matrix, which is a very detailed and extensive questionnaire that we have our patients fill out before we see them. Unlike, when you go to your traditional doctor, you fill out a questionnaire and you get some past medical history and what medications are you on, and, kind of surgeries have you had, and things like that. But the Living Matrix really, really is in depth. I mean, we go back to before you were even born. Did your mom have problems during her pregnancy? Were you a vaginal delivery versus a C-section? That makes a huge difference. When you're a vaginal delivery, you pick up your mom's bacterial flora that's in the vaginal canal and the birth canal, and that actually gives your immune system an advantage. Whereas if you're a C-section, you don't have that advantage. Were you breast or bottle fed? That also, makes a huge difference. Breastfed babies, studies have shown that they have a stronger immune system because they get through the breast milk a lot of immunoglobulins from the mother, whereas that doesn't happen when you're bottle fed. Childhood health history is so important. Were you a healthy kid? Or did you already have the beginnings of chronic problems like constipation and fatigue? Were you on antibiotics a lot? Did you have ear infections or tonsillitis a lot? And have to have through many courses of antibiotics? All of those things that happen in our childhood impact our adult health. And we don't make that connection a lot of times unless we ask. As I said, is there a history of heavy antibiotic use or steroid use? We delve into sexual, emotional, and physical abuse. Any history of abuse predisposes, studies have shown it predisposes to future health issues. So we really ask some very important and very personal questions. Cultural and social narratives are very important. It's important to know the cultural background of a patient because that tells us a lot about their diet, about their attitudes towards healthcare. So that's very important information. Family medical history is very important. What are you predisposed to genetically? Right off the bat, you might be predisposed to things that are out of your control. The Living Matrix also alerts us to toxic exposures, dietary habits, drug use, sexual health, physical and emotional stressors, quality of relationships. All of those things have bearing on your health and are important to know about. So we ask a lot of questions. We ask a lot of hard personal questions. It also helps us figure out what system is imbalanced at the cellular level. For example, when a patient comes in with certain complaints like anxiety, depression, insomnia, headaches, fatigue, muscle aches, the mitochondria can be involved. The mitochondria is the powerhouse of our cells. That's where energy is made. So if there's dysfunction at that level, at the mitochondria, that can lead to these symptoms. Another example is the gut lining. The gut lining is so thin and fragile. So if you eat a diet that's very heavy in processed foods, like the standard American diet is so modified, genetically modified, and heavy on chemicals. And those things damage the gut lining. And it leads to things like weight gain, obesity, reflux, bloating, constipation, diarrhea, allergies, food sensitivities, food cravings. Repairing the gut lining is going to be crucial to reversing those conditions. Another example is the immune system. It's interesting. A good part of our immune system is actually in our gut. So when you have gut dysfunction, you're going to have immune dysfunction as well. And you're going to have things like autoimmune disease and allergies and, skin conditions like eczema and acne, hives, even cancer. So it's important to know at the cellular level what systems are involved, and the Living Matrix is a great tool to helping us figure that out. So in addition to the Living Matrix, we do functional medicine testing, and it's a lot more detailed and thorough than conventional medical testing. I mean, we do the routine things that you would get with your primary care doctor, like blood counts and a chemistry and a blood sugar and liver and kidney tests and things like that, cholesterol. We do all of that. But in addition, we do things like a urine organic acid test, where we look for metabolites of the different processes going on in your body. It'll tell us how well you're processing your vitamins. It'll tell us how well your gut bacteria are functioning because they produce metabolites, how well you're breaking down medications, how much oxidative stress you have on your body. So it's a very, very useful test that tells us what's going on in your body at the cellular level. We do food allergy and sensitivity testing. A lot of people aren't even aware that they have some food sensitivities and don't make that connection with their symptoms like migraines. A lot of my migraine patients end up having food sensitivities, and when we take those foods out, their migraines either get better or resolve. We do a lot of hormone testing. We test for things like thyroid, cortisol, estradiol, progesterone, testosterone, DHEA, pregnenolone, growth hormone, all of which are made both in men and women. And when there's imbalance there, it can lead to a whole host of symptoms. And we also do extensive GI testing. We test for small intestine bacterial overgrowth, which has been linked to irritable bowel syndrome. By treating that, sometimes we can improve the symptoms of irritable bowel. We do stool testing, which will give us an idea of if there's any imbalance in your bacterial, your gut flora. Also, if you have any infections, any parasitic infections. It gives us an idea of if you're making enough pancreatic enzymes and gastric enzymes. GI mapping, which is a lot more detailed as far as to what bacteria, pathological and normal, are present. So, and these are just some examples. There's a lot more functional medicine testing at our fingertips that gives us a lot more information than conventional medicine testing. And those are things that, we address. So, after taking an extensive history using the Living Matrix and after, evaluating and analyzing all the tests that we order, which are customized to your situation, to your symptoms, we formulate a very customized treatment plan. No two patients are treated the same because everybody's different. Everybody's issues are different. And treatment often includes diet or diet modifications, supplements, because a lot of people have nutritional deficiencies that they weren't aware of, like low zinc, low B12, low vitamin A. It definitely includes detoxification because, we all store toxins in our fat layer. And, toxins that come from processed foods, pesticides, things that we're exposed to. And unless you take those out of the body, unless you turn them from a fat-soluble form to a water-soluble form so that you can breathe it out, you can sweat it out, you can urinate it out, you can poop it out, it's going to be in your body interfering with all your body processes like making your hormones and producing energy. So detoxification is a really important part of treatment. We have you work with a health coach. Everyone works with a health coach depending on what your particular dietary needs are. And if necessary, we balance your hormones. We use bioidentical hormones to balance your hormones. So we formulate a customized treatment plan. And really, it's not uncommon that patients are able to come off their medications and actually have a great deal of improvement in their symptoms. It really works. I mean, it's amazing. Patients often experience increase in energy, better sleep, improvement in pain, chronic pain, weight loss, libido, improvement in libido, improvement of GI symptoms like constipation, diarrhea, heartburn, gas, and bloating, reduction of PMS and menopausal symptoms, improvement of skin rashes, improvement in mood, and many other chronic complaints. And I just want to quickly take you through a case study. This is actually a patient that I saw in the office, just so that you get an idea of what our process is like. Amy is a lovely 45-year-old teacher. She came in complaining of a 35-pound weight gain the previous year. Her periods got really heavy. She developed this just terrible PMS and panic attacks, anxiety. Her hair started falling out. Her libido tanked. It really went down. She was exhausted all the time. She was getting migraines. She couldn't sleep at night. And she developed fibromyalgia, so she was always in pain. She also had severe constipation and bloating. And no matter what she ate, she could drink a glass of water and she would get bloated. So she went to her primary care doctor. He did some blood work and attributed most of her symptoms to perimenopause, which is, partially correct, and sent her to a gynecologist for an evaluation. So her gynecologist, did blood work, and found that they were normal, actually. And one thing I want to point out is that in traditional medicine, what they consider normal, we have a different reference range, because you can have completely normal labs in the traditional sense, but still have symptoms. So our normals are a little different than the normals at a traditional doctor. So what they consider normal, we may consider abnormal. So I just want you to keep that in mind. So he ended up putting her on an antidepressant for all her PMS symptoms. And then when she went to see the gastroenterologist, he also ran blood work and did a colonoscopy, and both were fine. Her blood work was fine and her colonoscopy was fine. So he couldn't find the reason why she was so bloated and constipated. So he put her on Linzess, which is a commonly prescribed medication for irritable bowel with constipation. But unfortunately, it gave her more bloating and it gave her loose stools. So she stopped it. She was actually referred to me by her sister, who was a patient, and her sister had diabetes, insulin resistance, and high cholesterol, and she was able to come off of her medications, and she was very happy with the program. So she ended up referring Amy to me. And, Amy filled out the living matrix like we have everyone do. And there's some things that stood out to me on the living matrix. First of all, when she was 39, she was hospitalized with a really, really bad case of food poisoning. She got some really heavy-duty IV antibiotics, and she got IV hydration. She was in the hospital for a few days. And just one thing, food poisoning does predispose you to irritable bowel as well as SIBO, or small intestine bacterial overgrowth. And the other thing that stood out to me was that same year, she went through a horrible divorce. And overnight, she became a single mom to an autistic 15-year-old son. So she was working full-time, taking care of him. She had a lot on her plate. And that's when she really started feeling poorly. So her symptoms had been going on actually much longer than she had let on. And then, prior to this, she was healthy, energetic. She had normal bowel movements, no PMS or mood issues, good energy. So this was a huge, this to me was a trigger for a lot of her health issues. So testing, her testing revealed that she had very high inflammatory markers. Where it was coming from, I have some hypotheses, but she had low zinc, low B12. She had extremely low vitamin D3, high cortisol. She had low progesterone relative to her estrogen, which is a condition called estrogen dominance. She also had low testosterone, low DHEA and growth hormone, and she was found to be allergic to shrimp and peanuts, which she was not aware of. And she ate both frequently. She loves Thai food. She was having Thai food twice a week, and had no idea that it was causing inflammation in her gut. So, that turned up. And her urine organic acid test showed that she was low on butyrate. Butyrate is a substance very beneficial to our body that's made by the good bacteria in our gut. So what that told me was that, she had the bacteria in her gut were imbalanced. She didn't have enough good bacteria. She had too many bad bacteria. Her urine test for heavy metals showed that she had high levels of aluminum and arsenic. And remember, I mentioned that those things, when you have toxins in your body, they interfere with your body processes, with your immune system, with making your hormones. So that was very significant. And she also had high cholesterol, and she was found to be pre-diabetic, which, wasn't surprised with her, given her sister's history. So when I met Amy at her 2-hour evaluation, and that's another thing, with functional medicine, we get to spend a lot of time with you, unlike traditional medicine where, it's like you've got 7 minutes and you've got to address everything. We're fortunate enough that we can really take time to listen to your issues and to formulate a really good game plan. So when I met her, we came up with a really good treatment plan to address all of her issues. I put her on an elimination diet, started her on a gut repair protocol, followed by a detox protocol. We corrected all of her imbalanced nutrients like the low zinc and the low B12, because you can't have a good immune system with low zinc. You can't have a good nervous system with low B12. So we supplemented all those, and we balanced her hormone with bioidentical hormone treatment. We also taught her some stress management techniques in order to reduce her cortisol levels, because if you're always stressed out and you have no way of coping with that, it's going to be really darn hard to lose weight and get your energy back. So over the course of 6 months and working closely with our health coach as well, Amy lost 37 pounds and she developed normal bowel movements. Her bloating resolved. She started sleeping through the night, really solid 8-hour sleep. Her mood improved greatly. I mean, it was just like night and day. Her chronic pain resolved. You know, she was told she would have fibromyalgia for the rest of her life. Well, no. You know, she was pain-free by the end of the program. She felt energized enough to start exercising because prior to this, she was too exhausted to exercise. So she went on to lose actually more weight than the 37 pounds. Also, her hair stopped falling out. It got thicker and shinier. And she noted that her nails were growing faster and her face was less puffy, something that she had commented on when I first met her. She actually, you know, she did so well that she decided to stay with us on a maintenance program, and her sister did as well. And she, you know what? She's kept the weight off, and she continues to this day to do well. She's one of our, you know, long-standing patients. So, you know, I was really, really pleased with how she did. So, you know, it's not a cliche that food is medicine. You know, your body is a wonderful, wonderful creation, and it wants to heal itself if you give it the proper nutrition. You know, if you help it with you know, giving it proper nutrition and, you know, stress management and, you know, exercising, you know, keeping it moving, your body will heal itself without needing or rarely needing, you know, prescription medication. So really food is medicine. So, you know, this is just a brief introduction into functional medicine and what we're about. If you have questions or if you feel that this is something you may want to pursue, that maybe, you know, we can help you with something, please schedule a free 15-minute consultation. You can send us an email at info@vitalitymedny.com, and someone will reach out to you to set up a phone call where we can see if we're a good fit for you. And I look forward to working with you. Thank you so much for sitting through this video.